So what's telemogene laherparibec, or what's called TVEC, TVEC? So this is the first oncolytic virus approved in oncology. It is a genetically engineered herpes simplex virus. Inside the genome, they have incorporated a gene, it's called the GM-CSF gene. And the GM-CSF, or granulocyte macrophages colony stimulating factor, it's protein, and this protein enhances the immune system. So this TVEC, I use it a lot in people who have in-transit melanoma. The in-transit melanoma, meaning, let's say you've got melanoma in the scalp, the surgeon went ahead and removed it, then after a while you'll start having this nodule or knots, very hard knots around the surgical scar. It could be in the scalp, it could be in the arm, it could be in the leg, and you see those, very hard, small, soft tissue nodules. You could feel them. And they are like, it could be one, two, or it could be many. I've seen as far as 50 of them. They could be 10, they could be 3. I found TVEC to be extremely effective. I inject those nodules with the oncolytic virus, and the oncolytic virus does 2 things. First of all, this virus could go to the melanoma, it will go to the melanoma cell and start replicating. And when it replicates, it leads to local destruction of the melanoma cell. But also, as it replicates, it secretes the GM-CSF protein into the tumor microenvironment, and that enhances the immune system and invite other immune cells to the melanoma area and started really attacking the melanoma and hopefully having an immune response. And those T cells, after they get once they identify the melanoma antigen, they started going and circulating in the body and trying to patrol the body looking for other melanoma cells in the body. In terms of the side effects, I mean, when I give it, I tell patients just probably maybe expect a fever. This fever could happen for a few hours, and try to take Tylenol. It could be some skin rash, but I find it to be extremely safe and really, really effective in transit melanoma. This figure is an illustration how TVEC works. You look at the green particles, those are the viruses. Look at the first line, the red cell is a normal cell, and TVEC inside it doesn't replicate. But the second line is a cancer cell, and it replicates and leads to destruction of this cell. And the third line, it invites these yellow cells, which are the dendritic cells that present the tumor antigen to the immune cell, and hopefully the immune cell will identify the tumor antigen and get activated.